My name is Martha Merrick. I'm the Executive Director for the Food Bank of Northwest Louisiana. Normally during a regular year, the food bank will help about 75,000 individuals. But when the pandemic shut our communities down, so many people lost jobs and found themselves without food. That's exactly the work of the food bank. From March up until today, we are seeing between a 30 and 35% increase each month in the amount of food that we distribute. One of our first concerns were children. With schools being closed, where were these children going to eat? So we ramped up and we opened 26 different sites and provided over 50,000 meals. We're so grateful for the work that we've been entrusted to do. As long as there's someone hungry in our community, we want to be there to help.
I am Ricky Carthon. I'm the president and one of the founders of 100 Men of Shreveport. We have been conducting nonprofit services since 1993. COVID testing is something that we got involved in because that is my profession. May 13th to current, probably tested over 5,000 people. We're doing regular sites that people know that they can go to and get tested for free, whether they have access to health care or a relationship with a doctor, and we get them tested in a quick manner so that they can know what their status is. We go out there every week with people that may have been exposed or just want to know. We're right there next to them.
So I'm Jessica Milan Miller. I'm the CEO of the Gingerbread House. We're the local children's advocacy center. We've been in the community for 22 years. Since day one, all of our services have been offered free of charge to child victims so that no child was ever turned away. We were closed for maybe about 1 week, right in the middle of March. And after that, we just realized that the demand was there. Children needed to be able to have a safe place to tell and be believed. Our forensic interviews have not stopped. When a child is ready to tell, they're ready to tell right then at that moment. And so asking them to wait until we're done with the pandemic is not in the best interest of the child. In June of this year, we had 86 new victims just in the month of June. And so the need is there. And once school is back in session completely, I believe that we will definitely see a huge increase in the number of kids coming forward. And so we'll still be here with doors open so that we can help them.
I'm Tammy Fleetwood. I'm the Executive Director at St. Luke's Mobile Medical Ministry. St. Luke's mission is to provide free preventative health care to the homeless, the low income, and the underinsured in the Northwest Louisiana community. We felt in the very beginning, when the pandemic started, of course, a lot of our clinics closed. And we stayed closed for a couple of weeks, and then we felt very strongly that we needed to get back out there. And we have not seen any positive tests or any positive symptoms in the homeless communities. Our group of residents don't have access or very limited access to all the news that's going on about the pandemic. So we're taking advantage of that and doing some real teaching about healthcare and trying to keep them safe. They're just people that came on a hard time and just need that little bit of help, just a connection to a group that cares about them. And you really find that with St. Luke's.